Assalamualaikum doctors. In this video I am discussing about Guillain-Barre syndrome. So GBS, what we do, nerve conduction study, look the pictures. They have peripheral nerves affected. The features are weakness and neuropathy. It is ascending from the lower limb started, sudden it occur, acute conditions, and there is antibodies positive against the Campylobacter. Campylobacter is the organism responsible for Guillain-Barre syndrome. It comes on neurology or history. So neurology clinical, high steppage gait. Remember, they have high steppage gait. The task may be short history of preceding any gastroenteritis. Remember, short history of preceding any gastroenteritis is the written on the comment. Now, when we examine normal mentality, normal speech, if Miller-Fisher, which has ataxia, areflexia with abducent palsy and bilateral facial palsy. It is an ascending paralysis. Distal is more affected than the proximal. Bilateral foot drop, orthosis, truncal support, decreased tone, power and reflex with motor and sensory affections, tingling and numbness with no sensory level. You have to comment on motor level and sensory level. L1, level of sitting, above can sit, below cannot. L3, level of crawling. S1 is level of standing, below it stands alone. S3, level of walking. Little toe, remember S1, big toe is L5, leg is L5 and knee is L3. Okay, that is the dermatomal distribution I tell. Sensory level start from the little toe. If intact sensation, so all the other sensation is okay. So if the little toe sensation is okay, then all the other toe sensation is okay. So this is Guillain-Barre syndrome. What investigations we do? First of all, lab CSF, cytoalbumin dissociation with high protein and normal glucose, no cells, negative culture. So CSF study we do for that, where we find cytoalbumin dissociations with high protein. Then EMG, acute denervations. Nerve conduction velocity is slow. Antigangliocyte antibodies, GM1 antibodies against the Campylobacter. Stool analysis we are doing. Radiology we are doing MRI of the sun to rule out the spinal cord lesion, X-ray of the pelvis and bone, tibia and fibula if unilateral, bedside blood pressure, ECG and spirometry. Follow up with the neurological examinations, cranial nerve examination, spirometry and blood pressure. So what is the follow up? Neurological examination, cranial nerve examination, spirometry and blood pressure. Investigation we understand that CSF, electromyography, EMG, antibody against the Campylobacter, nerve conduction velocity, MRI of the spine, X-ray of the pelvis and bone, and bedside we are doing blood pressure, ECG and spirometry. When poor prognosis, cranial nerve affections, respiratory affections require ventilation, maximum presentation disability at the time of presentations. Bulbar affection, no improvement after 2 weeks. So poor prognosis is that respiratory affections, maximum disability at the presentations. After 2 weeks, it is not improving. Then bulbar affections, then cranial nerve affections. These are. Treatment is I will admit the child in ICU. Remember ICU admission. So daily spirometry with forced vital capacity. FVC follow up. Respiratory failure is sudden and life threatening. So every day spirometry and FVC checkup. IV immunoglobulin and plasmapheresis, physiotherapy and rehabilitations. Steroid if intermediate or relapsing course. So this is the treatment. Admission to ICU, daily spirometry with FVC follow-up, IV immunoglobulin, plasmapheresis, physiotherapy and rehabilitation. Steroid if intermediate course. Team I will involve neurologist, pulmonologist, physiotherapy, occupational speech and language therapist, dietitian, ophthalmology, cardiology lies with the school and skin care for pressure ulcer. What are the common questions they ask from Guillain-Barre syndrome? Number 1, why it is not polio? Because there is no cranial nerve affection, asymmetrical, no sensory affections, no autonomic affections. CSF, there is no lymphocytosis, nerve conduction velocity is normal in polio and isolation of the virus in stool. So in polio there is a cranial affection which is absent, both sensory and motor, which is not affected in Guillain-Barre syndrome. In polio, nerve conduction velocity is normal, where Guillain-Barre syndrome it is slow. So common organism is Campylobacter, Helicobacter and COVID-19. Remember Campylobacter, Helicobacter and COVID-19. Precipitated vaccination is oral polio vaccine, meningococcal vaccine, rabies, flu vaccine. So the child has history of any vaccine taken recently. Complications of Guillain-Barre syndromes are respiratory failure, fluctuating blood pressure, arrhythmia, urinary retention, constipation. Again, complications are fluctuating blood pressure, urinary retentions, arrhythmia, constipations, respiratory failure. So this is all about Guillain-Barre syndrome, which is present with high steppage gait. Thank you.